101. In today's broadcast, we're going to be talking about sex and safe sex. What is safe sex? In today's broadcast, we're going to be talking about what is safe sex and how you can also encourage your partner to participate in texting. Okay? So pay attention. I know this is one topic that nobody want to talk about, but you have people. The number of STD and STI is skyrocketed every year because people don't want to practice safe sex and people don't want to talk about safe sex. So in today's broadcast, we're going to be placing more emphasis on safe sex. Okay, so safe sex means taking steps to protect yourself and your partner from sexually transmitted infection, STIs, and intended pregnancy while maintaining a healthy and respectful sexual relationship. Okay, so what is safe sex? Safe sex includes using protection, especially condom, during sexual activity, limiting the number of sexual partners, getting regular STI, sexually transmitted infection testing, open communication with your partner about sexual health. This is very, very important. Okay, avoiding sex when there are symptoms of infection, such as itching, sore, discharge, pain, painful urination, painful during sexual activity, or painful during ejaculations. So you need texting, and you should stay away from stairs if you're having these symptoms. Okay, so most effective way to prevent sexual infections. What are the most effective way to prevent sexual infections? There are medically proven methods. One would be use condom correctly. Male or female condom greatly reduce the risk of HIV, gonorrhea, chlamydia, and syphilis. Use a new condom every time you have sex. But please note that condom may not prevent infection completely, but it will reduce the risk of infection. Okay, so get that in the back of your mind. So get regular health checkup. Early detection prevent complication and spread. So remember, in Gateway 101, we places emphasis. When I say emphasis, we place great emphasis on healthcare awareness and prevention measure, because we strongly believe that prevention is better than cure. So we place a lot of emphasis on preventions and creating healthcare awareness to the community that we serve. Okay, so get regular healthcare checkup. It's very, very important. Early detection prevent complication and spread. Both partners should get tested before unprotected sex. Okay, before you engage on unprotected sex, both partners should get tested first. Very, very important. Limit sexual partner. Okay, fewer partners, lower risk of infection. Okay, avoid sharing sex toys. This is very, very important. Okay, if shared, wash thoroughly and use condom on them. Vaccination is another preventive measure that will help reduce the risk of infection. Okay, I said we encourage people greatly to get vaccinated. Okay, for HPV vaccine and hepatitis B vaccine. This helps prevent serious infection. We preach and we encourage people to go and get the HPV vaccine and hepatitis B vaccine, because this will help prevent serious infection. Okay, simple home practice that help reduce infection. These are supportive habits, not cure or replacement for condom or medical care. Okay, these are supportive habits, not cure or replacement for condoms or medical care. Okay, good personal hygiene. Wash the genital area daily with clean water. Okay, avoid harsh soap, perfume, or douching. They disrupt natural balance. We also encourage you to urinate before sexual activity and after sexual activity. This will help flush out bacteria and reduce urinary tract infections, UTI. Wear breathable underwear. Cotton underwear keep the area dry and reduce bacterial growth. Okay. Stay well hydrated. Support the body natural cleaning system. Healthy diet to support immunity. Eat fruit, veggies, yogurt, probiotics, and whole grain. Limit excessive sugars and alcohol. Important warning: there is no home remedy that can cure sexual transmitted infection or sexual transmitted disease. There is no home remedy that can cure STI. Okay? Use of garlic, vinegar, herbs, or vaginal wash do not prevent STI. If you notice a foul-smelling discharge, sore, itching, or painful during urination, seek a healthcare provider promptly. Okay? When to see a doctor immediately. Pain during sex or urination. Unusual discharge or bleeding. Seek medical attention. Sore, rashes or swelling, fever or pelvic pain. Seek medical attention. Okay? So let us recap. Okay? We started by saying that safe sex means taking steps to protect yourself and your partner from sexually transmitted infections, such as also known as STIs, and unintended pregnancy, while maintaining a healthy and respectful sexual relationship. We also said that safe sex includes using protection, especially condoms, during sexual activity, limiting the number of sexual partners, getting regular STI testing, open communication with your partner about sexual health, Avoid sex when there are symptoms of infection such as itching in your genital area, sore, discharge, painful pain during urination. You should avoid sex. Go and text yourself. Okay? I also said that the most effective way to prevent sexual infection, there are medically proven methods such as use of condom correctly. Male or female condom greatly reduce the risk of HIV, gonorrhea, chlamydia, and syphilis. Okay, we also said that use a new condom every time you have sex. Condom is not reusable. It's one-time use, then discard it. Okay, get regular health checkup. Early detection prevent complication. Okay, so we greatly encourage you to check yourself up as frequently as possible. Okay, both partners should get tested before unprotected sex. Yeah, strongly encourage, because you might not know what your partner is carrying. They might be carrying something very grave, but they don't have system of it. So before you have unprotected sex with your partner, both partners should be tested first. Okay, we strongly encourage you to get testing. Also, limit sexual partner. Fewer partner, lower risk of infection. That is true. Avoid sharing sex toys. If shared, wash thoroughly and use condom on them. Also encourage you greatly, because remember, Engage for 101 will create awareness to the community and also give you healthcare prevention tips, because we strongly believe that prevention is better than cure. So we strongly encourage you to take the HPV vaccine and hepatitis B vaccine. This help prevent serious infections. Okay, so some simple home practice that help you reduce infection risk. These are supportive habits, not cure or replacement for condom or medical care. Good personal hygiene. Wash the genital area daily with a clean water. Avoid use of harsh soap, perfume, or douching. They disrupt natural balance, mostly douching. Urinate before sexual activity and urinate after sexual activity. This helps flush out bacteria and reduce urinary tract infection. So please note that. Wear breathable underwear. Cotton underwear keep the area dry and reduce bacterial growth. Okay, stay well hydrated. Support the body naturally cleaning system. Healthy diet to support your immunity, like eating of fruits, vegetable, yogurt, probiotics, and whole grain. Limit your excessive sugars and alcohol. Important warning: there is no home remedy that can cure STIs, sexually transmitted infection, or sexually transmitted disease. Garlic, vinegar, herbs, or vaginal wash do not prevent STIs. Please note that. Okay? If you notice foul, smelly discharge, sore, itching, or painful urination, please see a healthcare provider immediately. And when to see a doctor immediately. When you have pain during sex or urination, seek medical attention immediately. Unusual discharge or bleeding, seek medical attention immediately. You have sore, rash, or swelling, smell with offensive, embarrassing odor, seek medical attention immediately. You have fever or pelvic pain, we encourage you to seek medical attention immediately. So we will be talking about safe sex for couples. We are saying that safe sex is important for married couple too, not just to prevent infection, but also to protect each other overall health and strengthen trust in the relationship. Okay, what safe sex means for married couple? We say that mutual faithfulness, being sexually inclusive with each other greatly reduce the risk of sexually transmitted infection, STI. Honesty about past or current sexual health is essential. Regular health checkup. You cannot overemphasize that. Okay? Greatly encourage people to check up. Muslim married couple. Both partners should consider STI screening, especially before marriage. If either partner had previous sexual partner, if there are symptoms like discharge, itching, sore, or pain. Routine medical checkup help catch issues early. Okay? Use protection when needed. Even in marriage, protection may be necessary. Condom help prevent STI and unplanned pregnancy. Okay? Recommended if one partner has STI, either partner has sex outside the marriage during treatment for infection. Family planning choice. Safe sex also include planned and healthy spacing of children. Condoms, oral contraceptive pill, injectable implant contraceptives, intrauterine device, IUD. Natural method require proper education. Okay? Choose a method together with a medical device if needed. Good genital hygiene. Wash genital area with clean water. Avoid harsh soap or douching, because this will alter natural balancing. Urinate after sex to reduce infection. Okay? Wear clean, breathable underwear. Avoid sherry towel or underwear. Open communication. Talk openly about sexual need and comfort. Any pain or unusual symptom. Past health issues, consent, and mutual respect are key to safe intimacy. Avoid risky practice. Okay? Avoid sex when there are open sore, bleeding, or active infection. Okay? Avoid alcohol or drug use that may impact judgment. Pregnancy and post-delivery safety. Follow medical advice on when to resume sex after childbirth. Use protection if pregnancy is not desired immediately. when to see your medical provider. See your medical provider if persistent vaginal or penis discharge. Seek a medical advice or see your medical doctor if foul odor, itching, or bony sensation is noted. Pain during sexual activity. Sore, rashes, or unusual bleeding. Make sure you see your medical provider. Safe sex in marriage is about care, responsibility, and protecting each other's health. Okay, so as usual, let us recap. Okay, let us recap for those joining us now and for better understanding. Okay, we're still talking about safe sex. I will say that safe sex is important for marriage couple, not just to prevent infection, but also to protect each other overall health and strengthen trust in the relationship. We also said that mutual faithfulness. What safe sex means for married couple? I said one, mutual faithfulness, being sexually inclusive with each other greatly reduce the risk of sexually transmitted infection, STI. Honesty about past or current sexual health is essential. I will also emphasize that regular health checkup is paramount. Both partners should consider STI screening, especially before marriage. Very important. If either partner have previous sexual partners, if there are symptoms like discharge, itching, sore, or pain, okay, you should go for regular checkup. Routine medical checkup help catch issues early. Okay. Use protection when needed. And we said even in marriage, protection may be necessary. Condom help prevent sexual transmitted infection and unplanned pregnancy. Okay. And we strongly recommend that you should use protection when one partner has STI. Either partner has sex outside the marriage during treatment for infection. Okay. Well, I would greatly say that you should actually stay away from sex until you are properly treated for STI. Okay. Family planning choice. Safe sex also include planned and healthy spacing of children. Okay. Condom, oral contraceptive pills, injectable or implant contraceptive, intrauterine device IUD. Natural method require proper education. Okay. Also that choose a method together with medical advice if needed. Good genital hygiene. Wash genital areas with clean water. Avoid harsh soap or douching, or this will alter natural balance. Urinate after sex to reduce infection risk. Wear clean, breathable underwear. Avoid sharing toy or underwear. Open communication. Talk openly about sexual need and comfort. Any pain or unusual symptom, past harsh issue. Consent and mutual respect are key to safe intimacy. Okay, avoid sex when there are open sore, bleeding, or active infection. Avoid alcohol or drug use that may impact judgment, pregnancy, and post-delivery safety. Following medical advice on when to resume sex after childbirth. Use protection if pregnancy is not desired immediately. When to see your doctor. Persistent vaginal or penis discharge. You need to see your medical doctor ASAP. If you notice foul odor, itching, or burning sensation during urination or during sexual activity, you need to see your medical provider ASAP. Pain during sex, you need to see your medical provider immediately. Sore, rash, or unusual bleeding, you need to see your medical provider immediately. Safe sex in marriage is about care, responsibility, and protecting each other's health. Okay, so let's talk about talking to a partner about sexual transmitted infection testing. We'll say that talking to your partner about sexual transmission infection testing can feel awkward, but it is an important and caring conversation. Here is a simple, respectful way to approach it. Choose the right time and setting. Okay, pick a calm, private moment, not during an argument or in the middle of sex. A relaxed setting help keep the conversation open and not defensive. Okay? Lead with care, not blame. Frame the conversation around health and not trust. Frame the conversation around health and trust and not suspicious. Okay? Suspicious. Example, I care about us and want us both to stay healthy. I think STI testing is part of taking care of each other. Use I statement. This helps avoid sounding accusatory. Example, I will feel more comfortable if we both got tested. I want us to be open about our sexual health. Normalize STI testing. Remind your partner that testing is routine and responsible, not a sign of wrongdoing. This is very important. You can say STI can happen to anyone, even without symptoms. A lot of people test regularly, just like other healthcare checkups. Okay. Suggest testing together. This make it feel like a shared decision, not a demand. For example, how will you feel about us getting tested together? We could make it part of our health routine. Be ready for emotions. Your partner might feel surprised, defensive, or anxious. Stay calm and listen. Acknowledge their feeling and understand this might feel uncomfortable. Reassure them this is not about mistrust, it's about protection. Okay? And be honest about boundaries. If dating is important to you before sex or protected sex, say so clearly and respectfully. For me to feel safe, testing is really important. And on a positive note, reinforce that conversation strengthen your relationship. Example, I'm glad we can talk openly about things like this. Okay. So, example, key takeaway here would be talking about STI testing is a sign of respect, responsibility, and care, not accusation. If your partner value your health and the relationship, they will eventually understand, even if it takes time. If you, okay, so let us recap. The takeaway here is talking about STI testing is a sign of respect, responsibility, and care, and not accusation. Okay, if your partner value your health and the relationship, they will visually understand, even if it takes time. Okay, so we're going to be ending today's broadcast here. But let's quickly recap. Let's quickly recap for those of you who just joining us. Let's quickly recap. We said that talking to a partner about STI testing can feel awkward, but it's an important and caring conversation. Help a simple, respectful way to approach it. We also say that choosing the right time and setting. Pick a calm, private moment, not during an argument or in the middle of sex. A relaxed setting helps keep the conversation open and not defensive. We also say that you lead with care and not blame. Frame the conversation around hate and trust and not suspicious. For example, I care about us and I want us both to stay healthy. I think STI testing is a part of taking care of each other. Use I statement. This helps avoid sounding accusatory. For example, I will feel more comfortable if we both got tested. I want us to be open about our sexual health. Normalize STI testing. Remind your partner that testing is routine and responsible, not a sign of wrongdoing. Okay? You can say STI can happen to anyone, even without symptoms. A lot of people test regularly, just like other healthcare checkup. So suggest testing together. This make it feel like a shared decision and not a demand. For example, how will you feel about us getting tested together? We should make it a part of our health routine. Be ready for emotion. Your partner might feel surprised, defensive, or anxieties or actions. Stay calm and listen. Okay? Acknowledge their feeling. I understand this might feel uncomfortable. Reassure them this is not about mistrust, it's about protection. And be honest about boundaries. If testing is important to you before sex or protected sex, say so clearly and respectfully. For me to feel safe, testing is really important. End on a positive note. Reinforce that the conversation strengthens your relationship. For example, uh, I'm glad we can talk openly about things like this. I would say that the key takeaway here will be talking about STI testing is a sign of responsibility and care and not accusation. If your partner value your health and relationship, they will eventually understand, even if the tax, even if it takes time. Okay, so do not be afraid to get tested for STI. We strongly recommended that you get tested. We use this platform to create awareness, and I would strongly encourage you to get to engage in protective sex, okay? Or to come your way again. This is Get Well 101, and thanks so much for staying with us for this broadcast. I will definitely see you tomorrow. Thanks and God bless. Bye bye.